Welcome back to the Deep Dive. We're the show that tries to cut through the noise and really get you well informed on some pretty groundbreaking topics.
That's the goal.
And today, we're plunging into a really fascinating frontier. Artificial intelligence in medicine.
Yeah,
Now, AI, it's already shown incredible promise helping discover drugs, assisting in surgery.
absolutely. Huge strides there.
But what about that core challenge? That really fundamental task of accurately diagnosing complex diseases.
That is exactly where we're focusing today. Our mission really is to unpack a brand new AI framework. It's called MedTVT-R1.
MedTVT-R1.
Okay. And this isn't just, another AI doing one simple task. It's specifically designed to pull together diverse medical data. Think ECGs.
Heart scans, right?
Yep. Chest x-rays, blood test results, the whole gamut, really. And the aim is to deliver comprehensive and, importantly, interpretable diagnoses.
Interpretable, that's key.
Yeah.
So it's about getting a more holistic view of a patient's health.
Precisely. Because, let's face it,
Diagnosing complex diseases is incredibly difficult. I think we can all appreciate that.
for sure. And the crucial information, it's often not in one neat package.
No, it's scattered, right,
Yeah.
across all these different kinds of medical tests and reports.
Exactly. And traditionally, most AI tools in medicine have really focused on just one type of data at a time, what we call single modal data.
Okay, so what's the problem there? What happens when the AI only sees one piece of the puzzle?
Well, it's like trying to understand a whole complex story by just reading, say, one chapter. It's just insufficient for many conditions.
Right.
Take something like diabetes. The signs aren't just in your blood sugar.
Oh, okay.
You might see altered heart rate variability on an ECG, or you could find pulmonary issues, lung complications visible on a chest x-ray. And then, of course, you have the abnormal glucose or lipid levels in the blood tests, the LH data.
So if the AI only looks at the blood tests,
It could miss the heart rhythm changes or
Yeah.
the lung issue. It gets an incomplete picture, which, could lead to a missed or inaccurate diagnosis.
and I gather that even the AI systems that try to use multiple types of data, the multimodal ones,
Yeah.
they often just give a simple yes-no answer. Like, is disease X present?
That's often been the case. They struggle with what the researchers here call robust long-text diagnostic reasoning and interpretable clinical insights for multiple diseases. It's that deeper level of explanation and handling multiple conditions simultaneously that's been missing.
Okay, so they lack that nuanced reasoning. How does MedTVT-R1 tackle that? How does it manage to weave together this complex story from all these different threads?
Right, so MedTVT-R1 is introduced as a novel multimodal large language model framework, an MLLM.
MLMO. Okay.
Its whole design philosophy is, and I'm quoting here, to perceive and integrate heterogeneous multimodal medical data, thereby enabling interpretable multi-disease reasoning and diagnosis.
Perceive and integrate heterogeneous data, so different types of data.
Exactly. The breakthrough is getting the AI to make sense of these disparate pieces together in context, not just looking at them one by one.
And the main data types it's juggling are those three we mentioned, electrocardiograms.
Yep. ECGs, so that's time series data, basically those line graphs showing heart activity over time.
Got it. Then chest x-rays.
CXRs, visual images, right, a snapshot inside the chest.
And finally, the blood tests.
Lab results, or LB data, that comes in as tabular data like a spreadsheet with numbers, labels, ranges.
So time series images and tables, that's quite a mix. Making sense of all that together sounds like the real challenge.
It absolutely is. And how MedTVT-R1 does it is fascinating. It really starts with the data it learned from. They created a unique data set called MedTVT-QA.
MedTVT-QA. Okay, so not just existing data.
No, this was specifically built for this purpose. It's described as the first attempt to simultaneously consider three heterogeneous modalities, ECG, CXR, and lab.
The first time those three have been brought together like this for training.
Apparently so, in this kind of structured way. It's a curated instruction beta set. Think of it like a textbook for the AI, but instead of chapters, it has question-answer pairs.
Question-answer pairs. What kind of questions?
Questions about physiological level interpretations, like what does this specific heart rhythm mean? And disease-level diagnoses. And crucially, it uses something called a chain of evidence approach.
Okay, chain of evidence. That sounds important. What does that mean in practice?
It really is critical. Imagine like a detective building a case.
Right, piece by piece.
Exactly. The chain of evidence approach fully leverages the complementarity and mutual corroboration among modalities.
Complementarity and mutual corroboration.
I say.
So how the different data points support or confirm each other.
Precisely. It teaches the AI how to find evidence across all the data types for a specific diagnosis. How does an abnormal ECG finding connect to something seen on the X-ray, and how do certain blood markers reinforce both of those things?
I see. So it's building that interconnected web of evidence.
Yes, and it's trained specifically on 7 common clinically significant diseases. Things like coronary artery disease, acute renal failure, hypertension, atrial fibrillation,
Pneumonia, diabetes.
and sepsis. Yeah, a really solid range of complex conditions.
Okay, that's a powerful data set concept.
Yeah.
But then how does the model itself actually process this? How does it decide, which piece of data is more important for a particular question? There's this thing called the modality perception layer.
MPL.
Yes, the MPL. That's a crucial component within the AI model. Its job is to enable efficient interaction and fusion among modalities.
Interaction and fusion. Okay.
Basically, it helps the different data types talk to each other effectively.
Yeah.
Its function is to capture the dependencies among different modalities and adaptively weight their contributions based on the relevance of each modality to specific diseases.
Adaptively weight, so it learns what's important.
Kind of like a skilled doctor knows that for, say, a suspected heart attack, the ECG is incredibly vital, maybe more so initially than some other tests. The MPL learns these relationships. The paper gives an example. ECG features are relatively more important for detecting coronary artery disease.
That makes sense. And it uses some sophisticated internal mechanisms, things called cyclic multi-head attention, and a contribution-aware operator to figure out these weights automatically.
Okay, so you've got this specialized data set teaching it the connections, and this MPL layer helping it weigh the incoming information. But how does it actually get good at reasoning? How does it learn to make accurate diagnostic calls, especially when multiple diseases might be present?
That involves another advanced training stage. It's called reinforcement fine-tuning, or RFT.
RFT.
The purpose here is to unlock the potential of the constructed data and boost the model's reasoning performance, basically to make it smarter at drawing conclusions.
And they use something special here, right? A Jaccard Reward. That sounds technical.
It is a bit, but the concept is really neat. Imagine a patient has, say, 3 different conditions. How do you reward the AI properly if it correctly identifies 2 but misses 1 and maybe incorrectly adds another?
Yeah, just counting correct isn't quite right.
Exactly. The Jaccard Reward is designed for this multi-disease scenario. It essentially measures the overlap between the set of diseases the AI predicts and the actual set of diseases the patient has, the ground truth.
So it looks at the whole group of diagnoses together.
Yes. It uses something called the Jaccard Similarity Coefficient to quantify that overlap. This pushes the AI to get the entire diagnostic picture right, ensuring its outputs are highly consistent with the ground truth labels, especially for patients with multiple conditions, which is very common.
That sounds like a much smarter way to train for complex cases.
Yeah.
Okay, after all this, the big question, how does MedTVT-R1 actually perform? Does it work in practice?
Well, according to the research, yes, it outperforms other leading multimodal LLMs when it comes to multi-disease diagnosis.
Outperforms them how? Just accuracy.
Accuracy is part of it, yes, in the clinical evaluation, but it also excels in natural language generation.
Meaning the reports it writes.
Exactly, generating clear, readable diagnostic reports. This really underscores the value of that staged training they used.
Right, the pre-training and then the fine-tuning?
Yeah. That physiological level pre-training first gives it a solid foundation of medical knowledge across the different data types. And then the RFT stage enhances the model's multi-disease diagnostic performance, allowing for that deeper, more effective cross-modal reasoning. It builds layer upon layer.
And they found something interesting about which data type it handles best, didn't they?
They did. It turns out the model's understanding of lab tabular data is superior to that of CXR images and ECG signals.
The blood tests again. Why would that be?
The researchers suggest it's because lab tabular data is inherently closer to a textual format.
Because LLMs are fundamentally text-based.
Exactly. Reading tables, numbers, labels, it's structurally more like text than interpreting the visual patterns in an X-ray or the complex waveforms of an ECG. It's easier for the current LLM architecture to grasp.
That's a really interesting insight into how these models think. Okay, can we walk through an example, see how it puts all this together for a specific case?
Absolutely. Let's take a hypothetical case study they likely analyzed. MedTVT-R1 is given the ECG, CXR, and lab data for a patient. It processes everything and infers 4 conditions: acute renal failure, coronary artery disease, hypertension, and sepsis.
4 serious conditions.
Okay. But the key isn't just the list, it's the chain of evidence it provides for each one, drawing on all the data.
Right. Show your work, basically.
Exactly. So for acute renal failure, the model might point to specific blood test results, severe hyperkalemia, high potassium, and elevated creatine kinase, suggesting muscle breakdown potentially harming the kidneys.
Okay, from the lab data.
Yes, and it also notes other blood results like metabolic acidosis, high anion gap, and lactate elevation, which are all indicators of critical illness affecting kidney function.
Got it. What about the heart condition, coronary artery disease?
Here, the ECG is crucial. The model identifies acute ST elevation myocardial infarction, MI, with anterolateral ST elevations. That's a classic ECG sign of a heart attack.
Okay, strong ECG evidence.
Then the blood tests corroborate. It finds elevated liver enzymes related to ischemia, meaning lack of blood flow, likely from the heart issue, and elevated lactate, again pointing to tissue oxygen deprivation. See how it links the ECG and lab?
Yeah, that connection is clear. And hypertension, high blood pressure.
For that, it might look at blood tests showing hyponatremia, low sodium, and signs of organ dysfunction, which can happen with long-term high blood pressure. But here's a cool cross-modal link. It also picks up on mediastinal widening on CXR.
Something on the chest x-ray.
Yes, a subtle visual clue on the X-ray that can suggest long-standing damage to the heart and major blood vessels from hypertension.
Wow. So it's pulling from lab and CXR for that one.
Exactly. And finally, sepsis, the body's overwhelming response to infection.
Okay.
Here it might see mild leukocytosis in the blood tests. That's a high white blood cell count, suggesting infection. Then the CXR shows a right lung field opacity, possibly indicating pneumonia or fluid buildup related to infection.
So ELEB and CXR again?
And more from the lab data. Severe acidemia and elevated lactate, plus signs of coagulopathy, blood clotting problems, which are common, serious complications of sepsis. It really demonstrates that mutual corroboration. They talked about multiple pieces fitting together from different sources for each diagnosis.
That is incredibly thorough. It's not just listing things, it's building that interconnected case, like you said.
Yeah, it's moving towards creating that complete narrative of what's happening with the patient.
That's a really powerful demonstration. But, no system's perfect, especially not in medicine. What are the limitations here? What's the path forward?
Good question. A major challenge, and this is common in AI, is data scarcity. The paper notes that precise disease diagnosis often requires a larger volume of multimodal data collected from the same patient within a similar time frame.
Meaning you need lots of examples of patients who had ECG, CXR, and lab tests all done close together.
Exactly. And getting that kind of comprehensive time-synced data at a large scale is really difficult in the real world. This currently limits how well the model might generalize to all patients everywhere.
Makes sense. Data is always tricky. Any other limitations?
They also acknowledge that even with these three modalities, truly comprehensive diagnosis could be even better with more data types.
Like what?
Things like the patient's detailed medical history, perhaps genomic data, other specific biomarkers. Information that just isn't available in the current open-source datasets they used.
Right. So while MedTVT-R1 is a big step,
It is a significant leap. But the journey towards a truly fully holistic AI diagnostician definitely continues. There are more data types to integrate in the future.
it really highlights those next frontiers for medical AI, doesn't it?
Absolutely.
So, to wrap up, MedTVT-R1 seems like a really significant advancement, as they say, in using these multimodal large language models for medical diagnosis. It's pushing beyond just looking at one test type to get a more holistic understanding of complex diseases.
Definitely. And the potential seems huge, generating those interpretable reports, understanding complex situations where patients have multiple interacting diseases.
Yeah, it seems this deep dive really shows us how AI is starting to almost think like a seasoned doctor, right? Connecting those disparate clues from a patient's complex story.
It's moving beyond simple pattern recognition towards actually constructing a cohesive medical narrative. It's quite profound, actually.
It really is. And as these models inevitably get more sophisticated, and hopefully as more diverse data becomes available, it raises a really big question for all of us, doesn't it? How is that relationship between human doctors, human medical expertise, and this kind of AI assistance going to evolve in the clinic? What new frontiers open up when AI can truly help see the whole picture of our health, working alongside the clinicians we trust?
That's the multi-billion-dollar question, isn't it? How do we best integrate these powerful tools into practice?
It's a future that seems to be arriving faster than we might think. Definitely something to keep a close eye on.